For decades, the Caribbean has been making real progress in the fight against HIV. Fewer deaths, fewer new infections, and more people getting the care they need. But that progress is now under serious threat. Right now, over 340,000 people in the region are living with HIV. Every single day, 41 more people are newly infected and 14 lose their lives. And just as we need to push harder, a major source of support has been pulled away. The United States has withdrawn its funding from the Global Fund, a move that's hitting civil society organizations the hardest.
We see there's a lot of mental health issues. If I know HIV is not curable, and I need to be on my medications every day, and I require social support for certain services that may not be directly delivered by the health system, then I need to depend on civil society groups to be able to do some of these things.
Civil society organizations play a quiet but crucial role in HIV treatment. Every day, diagnosed patients battle against stigma, shame, and other mental health struggles. Kimberly Simpson shares how the community often leans on each other through those organizations for support.
Well, yes, we have a group where, we support each other and stuff like that. And there are times we have our meetings and different things, and we would discuss certain things. But, like I said, when it comes to that part for no longer having that to help us or support us, I know it will be difficult for each one of us. Some of us might be afraid to admit it or say that, but, it will be difficult because then not everyone is brave like me.
For more than 20 years, countries across the region, including Belize, have been providing life-saving HIV treatment. And in 2023, Belize reached a major milestone by eliminating mother-to-child transmission of the virus. But while medication progress is clear, changing public attitudes is still a work in progress.
The Ministry of Health now is fully on board with the National AIDS Commission in utilizing what we call differentiated service models. And why do I call it differentiated service models? Because not everybody might want to go to the clinic, especially if you're a young gay man or if you're selling sex. The stigma and discrimination is still such that there are some persons in what we call the key vulnerable populations who may not want to be out there going to a clinic, and even if it is not absolutely real, the perception of the stigma and discrimination is still significant, even though we've been fighting this thing for over 35 years.
Dr. Richard Amenya stresses that while the region has been making progress, civil society organizations cannot be forgotten from their strategy. He stresses the need to engage the NGOs with the health systems, facilitating training and build capacity for outreach.
We know civil society organizations, their support for the HIV response, it's largely within the area of HIV prevention, working in trying to strengthen community partnership, engagement, advocacy, and addressing issues around human rights, stigma, and discrimination, and all those wraparound elements which impact structurally and socially on the HIV response. HIV is not just a health issue where you just take medications, but it's also about community support.
The Caribbean's battle against HIV isn't just about medicine. It's also about money. And right now, a major roadblock is staring governments in the face: debt. With international funding drying up, UNAIDS is urging regional leaders to stop looking abroad and start finding solutions at home. That means generating their own revenue to keep vital health services running, especially those led by civil society groups.
Guyana apparently is doing very well in their HIV fight, and also countries like Trinidad and Barbados. But there are challenges in the smaller, maybe Eastern Caribbean countries. I don't want to speak what I don't know because I don't know each one individually. But looking for funding sources, we will have to look within. In my view, that's my humble view. No, what we are asking in terms of our ramped up we have to scale up our HIV response now, in order to achieve the goal of 2030, that by 2030, HIV would not be a significant health threat to our people.
The time to act is now, before the hard-earned progress achieved in the region is undone. The fight must be holistic and inclusive to ensure that HIV patients are supported in all aspects of their journey. Britney Gordon for News 5.